All right, take 3, Dr. Brace here. I keep making this video and it's like 8 minutes long and nobody wants to listen to me for that long. So today I want to talk for Facial Plastics Friday about septoplasty, septorhinoplasty, and rhinoplasty. What's the difference, what's covered, what's not, and why? A septoplasty is when we change the shape. Plasty means to change the shape or the form. When we change the shape of your septum. So if it's curved inside your nose and you can't breathe, we straighten it, do a plasty of the septum, help you breathe. Your septum is that middle wall. A septorhinoplasty is when we straighten your septum and often take a piece of the septum and use that cartilage to graft your nose to support your nasal valve. So if you were breathing, your nostrils collapse inward like that, well, we can graft it, make it stiffer so it won't collapse. If you've had a trauma and your nose is crooked and we need to break the bones and straighten it and straighten the septum, that's a septorhinoplasty. That's covered by OHIP. We have to write pre-approval letters to the Ministry of Health in order to get a septorhinoplasty covered, and they do cover it for breathing. They full stop, never ever ever cover it for cosmetic or aesthetic concerns. So a septoplasty we can do, no questions asked. A septorhinoplasty we can do, jump through the hoop of writing a pre-approval and explaining that you can't breathe through your nose, you've had a trauma, it's crooked, they'll pay for me to straighten your nose, pay for me to graft your nose, pay for me to straighten the septum, help you breathe better. They do not cover taking a bump down, changing the rotation of your tip, changing the size of your tip, changing the size of your nostrils, or any of that. So what do we do? Sorry, they also cover fixing a septal perforation, which can be done at the same time as a septorhinoplasty, because often with trauma, if you have bleeding in your nose, you can develop perforation along with a crooked nose. So what do we do when somebody wants to breathe better but also wants to make cosmetic changes? Well, OHIP, the Ministry of Health, is pretty clear that they will cover the septal component of a cosmetic septorhinoplasty if it's necessary for breathing, but the patient's responsible for the rhinoplasty. In order for your septoplasty to be covered, you must have a valid health card for Ontario. You must have a referral from a doctor with a valid billing number in Ontario. And for it to be covered with the anesthetic portion, it has to be done at the hospital. And so practically speaking, I never do combined septoplasty by OHIP, rhinoplasty privately, because in order to satisfy the septoplasty component being covered, you're going to wait 3.5 years in my wait list for it to be covered by OHIP at the hospital. What usually happens is I just do the septoplasty for free because you're paying out of pocket for your rhinoplasty anyway. And so I make your nose look better and breathe better all in one surgery. And essentially, I just don't get paid for the septoplasty part from the government because I just include it in the rhinoplasty. Now, why would I do that? Well, it's just not worth it. The billing that we get for septoplasty is like $290. It does not even cover the sutures that we use in the surgery. And it would not give you a savings on your bill. It would just mean that I would be able to bill an extra $290 for the surgery. But most people that want to have a cosmetic surgery do not want to go through getting a referral and waiting in line to have the surgery. They just call the office or message the office and we can book it completely privately. So I hope that clears things up. If you can't breathe well and you have a health card and you have a family doctor or have seen a doctor with a valid billing number, they can refer you to me and I can help you with your breathing, but it gets done at the hospital because there's no charge, and that requires that you wait. If you can't breathe well, but you also want to make cosmetic changes, that's out of pocket. We fix your nose the way it looks. We fix your nose the way it functions. You'll be able to breathe better and like your nose. And that's how it works in Ontario. Everybody have a great March break, and I hope that clears things up. Send us your questions if you have any.